And welcome back. Well, these are incredible before and after pictures. Taking a look, though, you would think this transformation would happen over a very long period of time. The fact is, it happened in one day. That's right. It's with a procedure called the All-on-4, and it's making patients smile all over Southeast Wisconsin.
Yeah, and joining us now with more is Dr. Carl Drago and Maria Rivera from Eon Clinics. Hi, guys.
Good morning.
You're in the business of making people fall back in love with looking in the mirror.
Correct.
Aren't you?
Yeah. I mean, it's unusual for dentists to change people's lives, and we do that virtually every day. It's pretty cool.
Yeah, it's got to be a great feeling.
Yeah. To see some of the pictures, you know, that we just saw, and to know that that doesn't take months and months, it can really be one day.
Literally.
I think will shock people. I mean, talk through how you can do that in one day.
Well, what we do first is we identify where the location of the two front teeth. They're the drivers of the smile, the two front teeth. And once we identify where they belong, then that's our baseline, and then you make measurements from that and take photographs and models, and then we transform that in the laboratory and put the teeth where they belong, and those are the results that we get.
That's unbelievable. That doesn't even look like it's the same person.
And she's still numb there. That's literally as she was walking out. So she's still a little bit sedated and numb, so the smile almost looks stroke-like because, you know. So the better pictures are those where it's at either the first or second post-op, where the swelling is down and they have feeling in their lips and they're starting to say, wow, and their eyes light up when they smile.
Yeah.
So there's all this prep work, because I know you try to get a great color for them, you try to get the right size of teeth,
Correct.
You try to make it custom, and so it's beautiful from a cosmetic standpoint, but then the actual procedure all happens in one day, right?
Yeah, it's a long day for the patient.
Oh, wow.
They come in at about 6:30, the IV goes in at about 6:40, and they're walking out at about 3 o'clock with both sets of teeth screwed into place, and they literally walk out. They don't have to be rolled out on a wheelchair because the drugs that we use are quick acting, and they couldn't drive home, but they certainly walk out of the office.
Amazing.
And they're pretty thrilled.
These before and afters, I think, are just shocking to see how different you can look with a set of beautiful teeth.
Right.
I mean, it really changes your appearance. And Maria, I know you're the assistant. You're one of the people that, you know, sees them right away when they come in and sees them when they leave. How is that? How do you feel about that? And what do you tend to see when people come in?
It's amazing. You know, it truly is amazing to be able to see them from the beginning, how nervous they are, and then when they walk out, they're smiling, and a lot of times people bring tears to my eyes and hug us when they leave, and it's great to be a part of.
What about people who have, because I know bone is a problem a lot of times for people to have replacements in their mouth of implants. Can you do this procedure even if people have bone loss?
Well, the bone loss is, secondary to gum disease is not part of the skeleton per se. That bone gets removed anyway because it's infected. So we use what is called basal or basement or skeletal bone, and virtually everybody has that. Unless they've been without teeth for 30 years or so, then that may become problematic. But this procedure eliminates the need for 95% of bone grafting because of where we place the implants.
Wow. How long does the recovery take? I mean, clearly they look beautiful, but how long does the mouth take to recover?
Well, the mouth heals very quickly. Most of our patients don't even take a narcotic on the first post-op day, which blows people away at the consult because they're thinking you're going to do all of this surgery, take out all these teeth, and do all this stuff. And virtually none of them take a narcotic. So they feel, when they come back for the first post-op at 1 week, they're feeling pretty good. They are feeling very good. They might still be swollen, they might still have some black and blue areas, but that's pretty minimal. Certainly by the first month, you wouldn't know. I mean, you just wouldn't know that they've had anything done. They can speak and eat, etc.
You brought an example here because I think people are wondering, okay, you mentioned screwing it in. How does it work? Is it something people can take out, or is it permanent?
No, I can take it out with a special screwdriver. And we don't give those to patients, obviously.
Right.
So we take them out to get their teeth cleaned. It's very different than how you and I get our teeth cleaned, right? They come in, Maria takes out the fillings that are in these little holes.
Okay.
And then we unscrew them, and we give them to the laboratory technician, and he puts them in an ultrasonic bath, and then we repolish and refinish, and then we screw them back in, and the patient goes merrily on their way.
Do they need an anesthetic for that?
No, absolutely not. There are no nerves connected to anything anymore. So everything is above the gum line. And it feels odd when I tighten the screws. I mean, so we joke many times, and when we check this, and now you can really tell your husband you do not have any loose screws.
That's great.
Or your wife. It goes both ways.
Exactly.
Yeah.
I love it. Well, here's the information for Eon Clinics so that you can call and have a consultation, see if you're a candidate for the All-On-4. It's 262-798-0200 or eonclinics.com. Thanks to both of you.
Thank you.
Thank you.
Appreciate it.
Up next.